This patient was referred to me for endodontic retreatment of tooth number 22 in 2022. So, a year ago. Crown, previous root canal, periapical lucency, and patient had symptoms. These root canals were done in Bulgaria. Take a look at tooth number 21. Look how short the fill is. But that tooth is okay. Remember Dr. Lin's study? Unfortunately, with tooth number 22, tooth is not okay. The fill is short and tooth is not okay. What's the difference between these two? They're both filled short. This one's okay, this one isn't. These root canals were done 7 to 8 years ago. For seven years, number 21's been fine, even though the root canal was filled short. But number 22 is not fine. There's a periapical lucency. Patient has symptoms. The difference is this one doesn't have any microorganisms within the canal. This one does. So there's the difference between these two is that this one has microorganisms in the canal, this one doesn't. So even though it was filled short, but because there are no microorganisms in the canal, this root canal has been successful. This root canal hasn't been successful because there's been microorganisms in the canal and it's developed a periapical lucency. And here's the date. This is immediately after we redid the root canal for the patient. So went through the crown, removed that piece of gutta percha, and was able to regain patency, as you can see. Everything went great. As I said, this was a year ago, immediately after we did the redid the root canal for the patient. And here's the date, as you can see, almost a year ago. And this was just now. 1 year post-op of tooth number 22. As you can see, the periapical lucency is healed completely. And patient is asymptomatic, tooth is in full function. And here's the date, as you can see. And again, you can look at tooth number 21 and you can see tooth number 21 has remained disease-free and asymptomatic as well. So we were able to remove the microorganisms by redoing the root canal and get rid of this infection, and patient's body regenerated all that lost bone. As you can see, bone has regrown and regenerated. Here, as I said, tooth is in full function. Patient is asymptomatic. 1 year post-op of tooth number 22. Again, here's the date.